Okay, so the recording has started.
Thank you so much. So I just want to say good afternoon, everyone, and thank you to everyone who has joined us. So this is a webinar on organ donation hosted by thankfully Reka Dulandas, who is a sister and the transplant manager for Netcare KZN. And we're so happy to have her come and speak to us and bring us a wealth of experience and knowledge in the field of organ donation. And we're so honored to have her join us today and discuss these things with her. I just want to begin by saying that please keep your microphones muted unless you're speaking. And if you have any questions, please just raise your hand, use the chat function, and we will definitely address it sometime during the webinar. In addition, the webinar will be recorded and shared on YouTube later today. Thank you.
All right, good afternoon, Kiara, and the rest of your colleagues. Thank you for having me talk to you on organ donation and transplant. Just to make you all aware that August is Organ Donor Awareness Month, and there's a lot of drives happening at the moment in terms of organ donation and transplant. So I'm just going to discuss some of the following aspects with you guys. The main challenges that we have related to organ donation and transplant. What is the opt-in system compared to the opt-out system? The history of transplants in South Africa. What are the legal and ethical frameworks that we have to abide by? What is brain dead testing and the criteria before we do brain dead testing? What is the different types of donors that we have? And who is suitable to be a donor, and what are the costs surrounding transplant and organ donation. So organ donation is essentially a gift of life, and it's a medical procedure where an organ is removed from a donor body and planted into the body of a recipient to replace a damaged organ such as a heart or a lung. What transplant actually does is that it gives hope to thousands of people with end-stage organ disease, and it improves their quality of life. In South Africa, we've got just over actually 4,500 people waiting for solid organ transplants, and many of them happen to be young people. So teenagers, people in their 20s, 30s, 40s, and 50s. We have a lot of challenges with transplant in South Africa, and one of the biggest challenges we have is that the demand exceeds the supply. So the list is growing every single day of patients waiting for solid organs, but the number of potential donors we have has dwindled over the years. And there's many reasons for that as well. And that includes the lack of awareness. And I think that is one of the biggest problems, is that many people are not educated about things like their own culture and their own religion and what it actually says about donation and transplant. Many people don't want to talk about it at all because they think it's an absolute taboo. So all major religions and cultures of the world actually support organ donation and transplant, provided there's no harm that's come to a body, provided it's done within ethical means, and a body is not destroyed, that there's respect and dignity that is maintained throughout. Another challenge we have is the fact that government plays no role in educating the general population. We do not have national government policies that actually pushes the transplant program forward or normalizing organ donation in society. And as medical students, you all have taken the opportunity yourselves to ask me to address you guys, whereas it is not exactly included in your curriculum. And I think that organ donation and transplant needs to be included in medical programs, nursing programs, and other healthcare programs as well that are formal training. We don't have enough trained personnel. That means we don't have enough trained transplant coordinators in our country, and we don't have enough trained surgeons in our country for transplant. We also lack the resources available, and resources include transplanting facilities, so hospitals equipped with transplant doctors, surgeons, equipment, theaters, etc., flights, other emergency personnel, etc. So there's huge challenges that we're actually facing apart from just having a small number of donors. So the opt-in and opt-out system are two very opposite systems, and we talk a lot about the Spanish model simply because Spain came up with the idea of the opt-out system. So the opt-out system is where all citizens are presumed to be an organ donor unless they opt out of it. So in 1980, the government started educating the general population on organ donation and the benefits of organ donation and the legal and ethical aspects surrounding donation so that people are more comfortable with the idea of donation and are more willing to sign up to be organ donors. So with this mass education happening, it organ donation became normalized in society and people started believing that it's okay to donate organs. I'm actually trying to help somebody and there's no real harm in it. So they increased the number of potential donors from 14.3 per million population in 1980 to 49 per million population in 2019. And there's lots of research out there that shows how this program actually works. So South Africa is quite the opposite of the Spanish model. We are an opt-in system, and a person would choose to be a donor only at the time of death. And that choice is actually not even made by a deceased person, but it's actually made by a family member. So if someone's an organ donor, it's important that you actually let your family members know. So, if you look at the deceased donor rates per million population in some of the countries, and Spain is actually leading the world in terms of the number of deceased organ donors that they have. If you look at just the 2019 stats, Spain had 49 donors per million population, Portugal 33, Belgium 29, and you can see some of the numbers in their 30s and 20s there. But if you look at South Africa, we're sitting at 1.4 donors per million population. We're in single digits. So it tells you a lot about how poor organ donation actually is in South Africa. And if you look at the United States with 36 donors per million population, they do not follow the opt-out system like Spain. They're also an opt-in system like South Africa. However, they still have far more donors in their country. However, if you go to the United States and speak to any of the transplant facilities, they will tell you that this number is a very low number. So they expect a lot more people to become donors. And in South Africa, with 1.4 donors per million population, having nearly 66, 67 million people in our country, it just tells you that many people who are waiting for a solid organ transplant are actually dying while on that waiting list. These are just a little bit more stats here that you can see of other countries, and you can see that most of them are in double digits, and there's very few countries in single digits. So even smaller countries like Slovakia and Lithuania have far more donors than South Africa does. So this is just a short little video. It's about 60 seconds, and it's based on the first heart transplant surgery in the world. So I'll let it play. It's a little bit in Afrikaans, but you will understand it. And then we'll go on to talk about the history of transplant in South Africa. Oops, sorry. Let's try that again.
Sorry, I don't think the volume is coming through or the sound.
Hi, Kiara. Sorry, I heard you. So what I will do is I'll share my entire presentation with you as well that you could share with your team.
Thank you so much.
Okay, great. So anyway, while you may not have heard everything that went on there, I could share it on the side, but it actually discusses some of the legal, ethical, and medical aspects surrounding transplant just in that little video there. And this takes us to the history of transplant in South Africa. And what you're seeing here is a newspaper clipping of the site of an accident where a mother and daughter were hit by a vehicle. The mother was declared dead at the scene, and the daughter was ventilated and taken to the nearest hospital where she was actually declared brain dead. And at this point, um, history was made in the world where we ended up doing the first successful heart transplant. So the father of this woman was told, "Your daughter's now dead or brain dead. Would you consent to donating her heart and her kidneys?" Just also to keep in mind that his wife also just died in that accident. But he was very generous and he decided that he would sign that consent, and this changed history. So at 2 o'clock, they actually started operating on his daughter to remove her heart and her kidneys. And less than 4 hours later, her heart was beating in a recipient who was 54 years old, who would have died and had previous heart attacks as well. So this became known as the first successful heart transplant in the world. And the person who did the surgery was actually Dr. Christian Barnard. And the first picture you see here is the recipient on day one post transplant. And you can see he's well, he's not ventilated, and he's actually smiling. Second picture you see is 25-year-old Denise, who was the donor, and the very famous man was Dr. Christian Barnard, responsible for putting South Africa on the map in terms of transplant. Only a year prior to that, in 1966, did we do a kidney transplant with Dr. Stahls and Dr. Myberg. And this was done in the Western Cape in one of the government hospitals there. Then in 1967 was the first successful heart transplant in the world. And believe it or not, in 2014, South Africa was also responsible for the world's first penis transplant, and that was done by the Stellenbosch University and Tygerberg Hospital teams. Again in 2018, South Africa was responsible for the first partial liver transplant from an HIV positive mom to her HIV negative baby. So we've made history in terms of transplant and we've put South Africa on the map. So transplant is no longer seen as an experimental process. Most internal organs can be successfully transplanted. So just looking at some of the organs we can transplant, the heart can be transplanted, the liver, the kidneys, the bladder, the pancreas can also be transplanted, which is not on this list. But if you look on the left-hand side, these are tissue that can be transplanted, which is the whole eye can be transplanted, or the cornea. A windpipe, bone marrow, skin, and also heart valves can be transplanted. Over and above that, vessels such as your veins and arteries can be transplanted, as well as tendons. So just to talk about the ethical aspects surrounding transplant, the Declaration of Istanbul came about in 2008 by a group of, or not the South African, but the International Society of Nephrologists, who realized that there were a lot of illegal aspects going on with regard to kidney transplants around the world, where there was buying and selling of organs and illegal trading of organs and a black market for kidneys out there. And because they saw this as unethical, they convened, and this is how the Declaration of Istanbul came about, where they've aligned their principles with equitable sharing of organs, where there is no financial gain for organs that are donated, and it prohibits the trafficking of organs. It also prevents the coercion of poor and powerless people who are not able to make decisions for themselves. So South Africa is a signatory on the Declaration of Istanbul, so we do not support organ trading and trafficking. But this does not mean that it doesn't happen in some countries. Many of our patients are able to go to countries such as India, Pakistan, Iran, China, etc., and obtain a kidney transplant in those countries. So we follow the Department of Health stringent guidelines to prevent organ trafficking and payment for organs. So like I said, the Department of Health governs our practice. They also provide hospitals with licenses on who can do transplants, so both government and private sector hospitals. So in KZN, only a few hospitals have a license to do transplants, and that's Netcare St. Augustine's Hospital, Albert Lutuli Hospital, Life eThekwini, Gateway Busamed, and Lenmed eThekwini. The National Health Act of 2003, Chapter 8 covers transplants, so all the legal aspects are documented if you wish to look it up. So there are some criteria that needs to be met so that somebody is declared brain dead. And it means that a doctor has to do some tests. And we're basically looking at the cranial nerve functions and with 12 cranial nerves. And if they are damaged, then the patient could potentially become brain dead. So some of the tests that have to be done are your pupil response, the corneal reflex, the cough and gag reflex, the pain response, doll's eye movement, the cold caloric test, and finally the apnea test, which is the most important test. So, in terms of legal guidelines, two doctors have to complete the test. Ideally, the test should be done together to prevent the apnea test being repeated because your patient has to be off the ventilator for a while here. And one of those doctors has to be a consultant. No intern is allowed to do the brain death tests. Why do we do brain death testing? We want to prevent prolonged treatment. So we want to prevent a patient from being on a ventilator without a diagnosis. So we do brain death testing and to decide whether a patient is viable for donation or whether this family would like to switch off the ventilator. We also do brain death testing so that we can preserve organs that can be harvested for the purposes of transplant. And we also don't want to mistakenly diagnose anyone brain dead prematurely. Lastly, we want to maintain transparency with family members and give them a proper diagnosis. We have three types of donors in South Africa. We have donation after brain death, your DBD donor, also called a heart beating donor or cadaver donor. So, this is somebody who's on a ventilator but has been declared brain dead either from a traumatic brain injury or some kind of cerebrovascular accident. Then we've got the donation after circulatory death, which is your non-heart beating donor. And these are patients who would die in a general ward or at home. And they've essentially had a cardiac arrest, so they can only donate their tissue, but not solid organs. Lastly, you've got the living donor who can donate a kidney. They can also donate a portion of their pancreas, a portion of their liver, and possibly even a portion of your intestine. In terms of graft survival with regards to your cardiac death versus brain death, the results are very similar. If you just look at the 5-year survival rate of lungs on the brain dead donor and the cardiac death donor, it's about 90% on a cardiac death versus the brain death being 61%. And other countries do solid organs from your cardiac death patients, but it is planned death. So they switch off a ventilator on somebody who's not brain dead, where we know that any form of treatment for the patient will be futile and the patient will die. So I'm not going to go through all of the different organs here, but you'll find that the kidneys are quite similar with 86% and the liver with 71, 77%. So good graft survivals on them. In terms of the living donor, it is more common to donate the kidneys than any other organ as a living donor. Other organs, like I said, is the lobe of the lung, partial liver, partial pancreas, and partial intestines. So in South Africa, we don't do the pancreas and intestines any longer, or the lung, because we don't have the specialists for it. The partial liver is only done in exceptional circumstances and often mother to child. So we also have some patients who may not be suitable as a donor. If we do not know the cause of death, unfortunately, we are not able to use organs from that donor, even if a family wants to sign consent. This patient will have to have a post-mortem done to establish a cause of death. At that point, it's too late to remove solid organs. Patients with chronic kidney disease generally have a little bit of multi-organ failure, so the organs may not be as viable or well perfused for donation. And then of course, you've got your uncontrolled diabetes and hypertension. We very, very rarely would use organs from this kind of patient, but if it's controlled, we would definitely use their solid organs. With the active resistant infections, we're looking more at your MDR, XDR type of infections where they're completely resistant to antibiotics and we won't use organs from them. Hepatitis B, in South Africa, we won't use solid organs from them. When it comes to malignancy and cancer, there is an exception. And the only exception is an isolated brain tumor. So, anyone dying of an isolated brain tumor, we can use solid organs for transplant because there is no chance of metastases of cancer. Whereas somebody who's had a breast cancer or colon cancer some time ago has been treated and is in remission, we will not use any solid organs from there because the risk factor will remain. As much as I've got COVID on this, we have now recently started using solid organs from patients who are COVID positive. So most patients who die currently and are COVID positive, if the solid organs are perfusing well and are viable, we will potentially use those organs. Finally, there's an age limitation as well. And South Africa's age limit is between 18 months and 75 years of age. And we have done an 18-month-old, and my oldest donors have been 73 years, and I've had two of them thus far. It doesn't mean that we won't use older than 75 if the patient is healthy. Otherwise, we would potentially use those organs. In terms of costing, it doesn't cost one anything to be a donor. There's no cost to you or your family members. If you are a cadaver donor and donating all your solid organs, and if you're in the private facility in any hospital in South Africa, Netcare Transplant Division will actually take over the bill and will not bill your medical aid. If you're in the government sector and you're a cadaver donor, there is no expenses or cost to your family at all, provided your family gives consent for removal of organs. We also don't compensate the family for the donation because we're saying it's a gift of life from one person to another, and we don't support the illegal trading of organs in South Africa. So what is the process? Legally, we have to get written consent from a family member or next of kin. The donor has to be managed in an ICU so that we can optimize organ perfusion and correct electrolytes, etc., correct the oxygenation of the patient, the ABGs, the PCO2s, PO2s, etc. We have to maintain adequate urine output, good blood pressures on a patient before we can actually harvest organs. We arrange the theater, and when we go into theater, we treat patients with respect and dignity. Their wounds are sutured and dressed with a shroud covered before sent to the mortuary or funeral home. We also have a donor pause, which is a moment of silence to honor the donor and the donor family. And we've recently introduced the guard of honor. And this guard of honor is only done with permission of the family and videoed with the permission of the family. We try not to delay any funeral arrangements, so we harvest as soon as possible. And in my experience, it's taken at least 20 to 30 hours before we can actually get to theater because it does take time to arrange theater teams. And often we have to fly surgeons in from other provinces as well. So we really lack resources. That is why it can take as long as that to get to harvesting. We try and maintain as much confidentiality as possible, and this is the Department of Health requirement. So donor and recipient families often don't get to meet, and we maintain strict confidentiality with them. When we take over payment of a donor in hospital, we do not use the donor name anymore, but we rather give them a unique donor number. So the only recipients and donors who do know each other are those living donors and recipients. But we do request that our recipients write letters of gratitude to the families, to donor families, that we can pass on to them, while we also remove all the personal details. So these letters are anonymous. So donor families do get to know what became of the organs that were donated and the lives that they have actually changed. So for you guys as future doctors, just remember when you do your rotation in emergency medicine, this is where often you would find donors that are pronounced dead before they even get to any ward or ICU. So you have a responsibility as well to refer those donors to your transplant team. And these are just quotes from doctors who work in emergency facilities in the United States and in Canada. and there's plenty of articles that are published where they find that they are missing a lot of opportunities from emergency departments and trauma units because they are not identifying these donors early and referring directly to transplant. Whereas these patients end up in an ICU, and after a few days of being in an ICU, they become septic. Whereas your donor from the ED is less likely to have sepsis, is less likely to have a poor perfusion. So these would make really good donors. So some of the things South Africa needs to consider is a national template or care pathway for potential donors or patients progressing to brain death. We need end of life care pathways, which includes organ donation as one of them and not just a DNR. We need national and local guidelines and policies, as well as core competencies in nursing and medical training programs. As stated earlier, this is not part of your core curriculum. And I think it really should become a part of your core curriculum where the prerequisites of brain dead testing, and brain dead testing is actually done in detail, and how to refer to transplant teams, because many people are also afraid of referring to the transplant teams, mainly because of the ethical and legal aspects that they are concerned about. But we have adequate guidelines that protect us where we would not step out of those boundaries. Also, to incorporate organ donation as part of hospital orientation programs when they hire new nurses, to just include it as part of their program. And finally, to have the Department of Health involved in promoting donation and creating awareness amongst the general public so that it becomes normalized in our society as something that's a feel-good program. And I think most religions and cultures would actually support it as an act of giving, as an act of love, and an act of generosity. So lastly, I think here, and this is very much a personal opinion, where I think that we need a routine referral policy in every hospital, both government and private, where the Department of Health makes it compulsory for doctors to refer potential donors to the transplant coordinators to be evaluated for possible organ retrievals. And that's just my talk to you guys. This is just a little harvest that we did. So you can see hearts still beating when we get to theater. And it's only when we do a cross clamp that the heart stops beating and we go on to perfusion before removing that heart and lungs, and then finally the liver and the kidney. So this is a heart that's been removed and being packaged for transport to a recipient. This is the lungs, and you can see it's quite pale. So obviously it's only the recipient's blood that flows through these organs and not the donor blood. It goes into a preservation solution called custodial, and we also have time frames in which to transplant these organs. So heart and lung, we look at a time frame of about 4 hours. The liver is 6 hours. Kidneys, we have between 6 and 24 hours to transplant. Whereas corneas, we have can be stored for up to 14 days. Bone can be stored for up to 5 years, and skin can be stored for up to 5 years. So thank you all for allowing me to talk to you on organ donation and transplant. These are just some of my references. I'm happy to take any questions at this point. So Kiara, I'm not sure if there's any questions for me.
There aren't any in the chat. I just wanted to ask if you could explain the easiest way for us to actually put our names as organ donators or as good donators, etc.
Yes, certainly. And I should have put this on the slide. You can register on the Organ Donor Foundation website, and the website is www.odf.org.za. So I'll send this to you and you can share it with your team. It literally takes a minute to register. There's not much details that's required. But it's important that you tell your family members that you'd like to be an organ donor when you pass on, so that they can sign your consent at that time. Because even if you write it in your will, Your family still needs to sign consent at the time of your death for organs to be removed. I hope that answers your question.
Yes, it does. Thank you so much. That's a really easy and accessible way for most of us. Does anyone have any questions? Please feel free to unmute and ask any. Okay, Reka, thank you so much for the talk. I think then we can end it there. And
No problem at all. Thank you so much. What I will do is I'll actually share my slides with you so you can share it
yes,
with your team.
thank you so much. And then as
All
soon
right.
as the recording is shared, we'll create snippets and share it on Instagram and YouTube and TikTok just to try to raise awareness.
Fantastic. Thank you so much and take
Thank
care,
you so
everybody.
much.
And it is Organ Donor Awareness Month, so please register. There's also an Organ Donor Memorial Day that we're having on the 17th of August, and that's at the Botanic Gardens at 10 o'clock. It's a beautiful site where you can take your family to. And what we actually do is we write every donor's name in stone, and it's actually laid into the ground there. So there's actually a memorial site for all the potential donors, for all the donors that we've had over the years.
Oh, that sounds so beautiful. Do you, if there's any further details, please share them to us so
I
we can
will
share them with students.
certainly will do. Thanks so much and take care, everybody.
Thank you. Thank you everyone for attending.